Hello, my name is Patty Duralton, and I am an LCSW CADC. CADC is a Certified Alcohol and Drug Counselor, and I am here to share with you my experiences as a social worker and how I got to where I am today. Let me start out by telling you that I work in two different places. I work at Stony Brook Center, which is a substance abuse treatment facility that does medicine-assisted treatment like methadone, Suboxone. I'm sure you've heard of those things before. And what led me there was really my openness to try anything. I was trying to get back into the work field, and I was just wanting to do anything, working with people. So I think my openness kind of led me there. Let me see, what are the other questions here? So at Stony Brook Center, I work as a therapist, and I have 33 patients that I work with anywhere between weekly and monthly, trying to help them meet their goals. There are people that are being worked with in an outpatient facility, so they're able to try and reach their goals in an outpatient way. So it's not inpatient, but it's outpatient, working with people with substance abuse issues. A lot of times there's dual diagnosis, so there's a lot of work that needs to be done with each individual. So that's what I do primarily there. I also work at a facility called Natural Balance, and that place is where I do equine assisted psychotherapy, and right now I'm working with adolescents. And that is really individual counseling. That's what that is. So it's the same thing, but it's a little different in the way that one's an agency and one is I'm on my own. So those are the two jobs that I'm doing right now. The equine stuff is pretty neat. I got into that. I was trying to become more marketable again, open-mindedness. I thought I would try this out. I have a therapy dog, and I got an extra certification in animals and human health, and that's what led me into equine-assisted psychotherapy. So those are the two things that I do. I think in terms of personality traits, what things do I have that led me down the path of social work? I think that empathy is a big one. I think boundaries is another one. I think hope, as well as problem solving. I think those are four qualities that I have innately that make me a good social worker. What do I like best about my jobs? I love working with the patients and seeing them progress through that therapeutic alliance. I think I like that in both the positions that I do. Obviously, the one at the equine assisted facility, it's working with the animals and seeing that animal-human bond work in a different way to be able to get the same type of results, but in two very different ways. It's very neat. My most challenging part at working at Natural Balance is just getting the patient. So working as an independent contractor, it's getting the referrals and building that caseload in that scenario. And at Stony Brook Center, I think it's the agency setting. It's the high turnover, high burnout of counselors, and so it's really hard to get some consistency with the administration. So I think that's probably my most challenging part at Stony Brook Center. Advice, I would say early on I learned the importance of self-care, and again I'm going to mention boundaries here because I think the very things that make us good social workers are also the very things that can burn us out, like empathy, like that ability to connect with others. I think those things, if you're not watching it and not making sure you're taking care of yourself and not having boundaries and not trying to solve problems for a patient or a client, but help that patient or client solve those problems on their own. I think those are really important things to know. I guess that would be my advice to future social workers. And I think that's all. So thank you.